Good morning everybody, my name is Nasywan from Group 26, and in this video I'll demonstrate how to provide care for patients with indwelling catheter. So first and foremost, we need to understand what is a catheter. So catheter is a medical device that allows us to help patients who are unable to urinate properly. For example, a patient with urinary retention or patients with neurological disease that causes them to be unable to control their urinary bladder. This causes them to urinate at a random time. Now there are actually 4 types of catheter, but in this video I'll show you only 3 types. The first is the straight catheter or French catheter. The second is the Foley's or indwelling catheter. And the third type of catheter is called the suprapubic catheter. The first type of catheter is called the straight catheter. The straight catheter is inserted into the patient's urethra until it penetrates into the urinary bladder. As you can see in this picture, the catheter is inserted into the patient's urethra until it reaches the bladder. Once the urine inside the bladder has been removed, the catheter must also be removed as well. The second type is the indwelling catheter, and the way that you differentiate them is the presence of the balloon at the tip. So this balloon actually helps the catheter to stay in place in the patient's urinary bladder. Once inserted, the catheter will actually remain in the patient's body for a quite period of time, depending on the situation. The balloon helps hold the catheter in place, and there's also a pouch in which the urine will flow through the catheter. The third type is called the suprapubic catheter. This type of catheter is more complex because it requires surgical procedure. The doctors will actually make an incision at the urinary bladder, which allows the catheter to be inserted directly through the abdomen into the urinary bladder. Urine will then be collected in the pouch. And now, I will show you an amateur demonstration on how to care for a patient with indwelling catheter. So for the first step is actually to prepare all the necessary equipment. For example, you need mask, sterile gloves, and even apron if you think it's necessary. You also need the catheter itself and also drape. One drape will be used to cover the patient's perineal region, and the other drape will be used to cover the bed. You also need sterile applicators and also antiseptic solution. This is for you to actually allow... You also need sterile applicators and also antiseptic solution. This is for you to clean the patient's genitals before inserting the catheter. Hi, good morning, Madam Melissa. My name is Nasywan. Can you tell me your birthday first and foremost? 29th of August. Alright. So, Madam Melissa, I just want to tell you that I came here because I want to perform a catheter. I want to care and insert catheter for you. So, do you need any time to prepare? You don't need. Alright. So, wait for a moment. I'll go back and take all the necessary equipment. Alright? Okay. After you have prepared the equipment, what you need to do is you need to make sure that the patient is in position. Tell the patient to lie down on their back or in supine position, and make sure that you place a drape behind the patient. This is to protect the bed from any urine that comes out. You also must make sure that the patient's legs are open. In this picture, the knees are bent and the hips are open. Before you clean the patient's genitals, always place a drape which actually exposes the patient's genitals. This will be easier for you to clean them. If your patient is male, then you need to clean the patient's genital from the glans penis to the direction of the shaft of penis. If your patient is not circumcised, then you need to pull the foreskin to expose the glans. If your patient is female, then what you need to do is you need to use your non-dominant hand to open up the patient's vaginal lips. From there, use your dominant hand to clean the patient's vagina. Cleaning the female genitals will be slightly complicated because it depends on the patient's age and also the patient's physical condition. For example, patients have obesity. Male genitals are a lot easier because you can identify themselves immediately. Sometimes, people even mistaken the urethral opening with the vaginal opening. After the catheter has been successfully inserted, we will then proceed with caring for the catheter itself. Secure the catheter's position close to the patient's body using a strap. This is to prevent injury caused by accidental pull of the catheter. The tube must also be coiled to prevent kinking, which could stop the free flow of urine into the drainage bag. The drainage bag must be placed lower than the person's bladder in order to prevent backflow of the urine. If such situation happens, then it might lead to infection. The bag must also be attached to the frame of the bed instead of the rails. Make sure the tube is attached to the bed sheet and also prevent the patient from lying on the tube. This might actually cause blockage of the tube. As a nurse, you need to pay a lot of attention to the patient and observe any changes or complaints from them. For example, if you observe that the urine is not flowing properly, then you might need to inform the nurse because perhaps maybe there could be a blockage inside the catheter. If the patient complains of discomfort or pain around the area, also keep that in mind and remind the nurse. You should also observe the changes in the color, texture, and property of the urine. If you observe any swellness or redness around the area, report it immediately to the nurse. And lastly, make sure there is no leakage of any urine from the catheter insertion site.